Hello, everyone. Welcome to our first social media live event with Dr. Kimryn Rathmell. I am your host, Sabrina Islam Rahman, and I lead social media at the National Cancer Institute. I hope you're all just as excited as I am to spend the next 30 minutes or so with our newest director. She'll start off by giving us a peek into her background and career, and then she'll take some questions from you. So if you have any questions, go ahead, drop it into the comments. We'll get to as many of them as we can today. Now, without further ado, I am happy to introduce Dr. Kimryn Rathmell, sworn in as the 17th Director of the National Cancer Institute on December 18, 2023. Dr. Rathmell, welcome.
Thank you. It's great to be here.
It's so good to have you with us today. This is only your second month as director, but you come here with a long career in cancer. I'd love to hear more about what that journey's been like for you, but my first question is, what made you say yes when you got that call asking you to lead one of the largest funders of cancer research?
Great. Yeah, so, Sabrina, I have to say, I'm a physician scientist, and I've been working in the cancer arena, funded by the NCI, working with investigators at the NCI for 20 some years, and have always held the NCI at the pinnacle. Just, it's a phenomenal place. And so it was inspiring to get this opportunity. And in the 2 months I've been on the job, I've felt like a kid in a candy shop, really learning so many things and getting the opportunities to listen to people. This, I'm really looking forward to hearing the questions from people, really getting a sense of what's on folks' minds. So in terms of why I took the job, I'll actually start with a little bit of my background that would set me up to want to do this. And so I grew up in the Midwest. My parents were teachers. Mom's a shop teacher, dad a science teacher. And so I grew up really interested in how things work, sort of the biology side of how things work, the construction side of how things work, all of that. My pivot into medicine came in high school when I started working in a nursing home, working very closely with residents there, and also trying to understand how to overcome challenges with them. And that made me go on and study science and become a doctor. So how do you get from there to a place like this? So my early career as a physician was focused on a cancer that's not that uncommon, but that a lot of people don't think about, which is kidney cancer. Got interested in kidney cancer for two reasons. One, as a scientist, there were really interesting problems to study, and my laboratory was really diving into some of those. As a clinician, I was meeting patients with kidney cancer, and this is now 20 some years ago, and there were really no effective options for therapy. The patients I would meet had a very short survival to be expected, and it seemed like an opportunity for the science to drive something that was different. And I have to say that in the next decade, that it delivered so much more than that even. The discoveries from the laboratories helped us understand how that cancer works and led to, I remember the first drug that came, and we had a clinical trial, and we put patients on this trial, and then they went from living 3 months to 6 months, and 6 months to 12, and 12 to 24, and their tumors shrank. And the next generation drugs came, and the next after that. And today, kidney cancer is a completely different beast. It's got a number of fantastic therapies. We can talk about cure with patients. There's a community of doctors in this space, and the marriage between the science and the output continues to be just continuous. So I think getting the opportunity to live in that space really set me up to want to do more of that. About 8 years ago, I moved to Vanderbilt to run the hematology oncology division, taking the same kinds of opportunities and spreading them to other cancers as well, and getting to work with teams and learn how you can understand how things work, finding great challenges and diving into them. And then I had a big pivot, which was that the chair of medicine who had recruited me there left, and I moved into working in the Department of Medicine as the chair in January of 2020. So the Department of Medicine is a big chunk of that is cancer, but it also spans everything from urgent care and walk-in clinics to the ICU. As I mentioned, it was 2020, so in March of 2020, everything changed. This is the COVID pandemic. And at our institution, we were responsible for utilizing the talents of everyone, the scientists, all of these clinicians, to really meet the needs of patients in our hospital, patients in our community, and a whole network of patients. And so seeing how those kinds of things can work together, again, really was one of the most intense learning experiences of my life. I'm sure everyone here also has stories from the pandemic era. So then when you get the call to look at the NCI, I mean, it's the same, right? It's science married to clinical output on a nationwide and a global scale. And so I just couldn't think of any reason that you wouldn't want to be a part of that. And I've discovered in the first couple of months that things are really as fantastic as I had ever thought that they were, and that we have good structured plans, and really looking forward to working with people to make tremendous inroads in the cancer arena. So.
No, thank you, Dr. Rathmell. And we're glad you said yes.
Yes.
It's definitely gratifying to hear the passion and conviction that you really bring to this role. Like you said, unfortunately, so many of us have been touched by cancer. And a lot of what you just talked about, I'm sure, resonates with many of our viewers. For me, it does, for sure. We lost my father-in-law to multiple myeloma a few years ago. So I understand the urgency to the work being done, not just by NCI, but really by the entire cancer community. It's certainly a collective effort. So that gets me to my next question. With cancer, it's the long game, and you've been doing this work for a long time. And even though you're new to NCI in this role, NCI isn't new to you. So what have your first impressions been so far, now that you're looking at things from a slightly different vantage point?
Yeah, I mentioned, how impressed I've been with the people and the scale of the programs that are here. I think that the thing that has been most striking to me is the sense of mission. The people who dedicate their lives to ending cancer are really passionate and bring incredible talents. And so the opportunities that we have are just tremendous. There are huge challenges. This is a hard problem to tackle. In fact, it's not one problem, it's 1,000 problems. But we have the wherewithal, we have the strategies to be able to make really tremendous improvements. And so that's what my experience has felt like in the first 2 months, is finding all the levers and figuring out how we can go.
Right. And I know the early days on the job have been busy. You've been spending your time listening and learning from the community. And what I've seen and what comes through very clearly for us is how important it is for you to hear from the community. And we've got many of them who've joined us today and are watching this event. And it looks like we do have some questions for you. So we'll get to those in a second. But before we do, I just want to make sure I share the information we have for people looking for general cancer information. So if you have a question related to cancer, you can contact NCI's Cancer Information Service at 1-800-4-CANCER, or chat with us online at cancer.gov/contact. We'll put that information in the comments for you. So let's get to our first question from viewers. And this one's from YouTube. So the question is, what have been some of the greatest adjustments in entering the director role? And as you get settled, how are you envisioning your mission in directing NCI?
That's a great question. The first thing that I'll say that comes to mind that's been the biggest adjustment is learning to do events like this. But I think about the NCI role in sort of two ways. One is the administration of a big organization and making the systems work together, making sure that, and by the NCI, I mean the intramural program and the extramural program, and coordinating all of those activities. That actually has felt very comfortable. The place runs quite well, but I also come with a lot of background to that space. The other half, I would say, of the job has been more the up and out. And this is part of that, but it's making sure that we're communicating with all of the different stakeholders and learning how to reach people where they are and learning how to communicate really effectively. And the team here is fantastic. They've really worked with me to be ready to hit the ground running and not wait to be having those conversations. But I love the duality of the role.
No, that's so true. NCI is a big organization. The cancer research enterprise is huge, and to be able to coordinate that and lead that is no small task for sure. The next question we have is again from YouTube, and it's about the mechanisms for transparency in determining how research dollars are allocated.
So I think that question is asking how do we inform our taxpaying public what we're doing with the funds that come here. So we have good reports that we provide, but I think that most important is to be able to really communicate well about where dollars are going that make a big difference for science, for patients, for policies, and for the whole package. I think one of the things that really is important in thinking about how we make a dent in cancer or end cancer as we know it is to be thinking carefully about how we steward those dollars, but also to leverage all of the partnerships that are available to us. So we really have to be working very closely alongside partnering institutions, and so we're doing that as well. But it gets back to the up and out communication part. It's making sure that people know what we're doing and where the discoveries are taking us.
Yeah, absolutely. You talk about ending cancer as we know it, the collaborations. I think one of the key points there is that everyone has a role, and we're all in this together. So that's such an important point to make, that everyone in this community is coming together to really take on this task. We have another question here, which is also from YouTube. And the question is, actually, this is from LinkedIn. What frontier of cancer research particularly interests you?
Oh, that's a really hard question because there are so many really exciting frontiers.
You could probably go on and on with this one.
I could, and it depends a little bit on the day. But we do have to maintain focus, and we have to put our priorities out there. So, I think, you look at the investments of the NCI over the last decades, and they shift with where the biggest return on investment is going to be. There was a big announcement this week about a new immunotherapy effective in melanoma, the first cellular-based therapy in a solid tumor. I think continuing to really fully tap what there is to do with the immune system and that interaction with cancer, that's got to be a major focus area scientifically. I think we can also talk on sort of global level of things that need to be big priorities, which are how do we get discoveries and best practices into the hands of every patient who needs them, whether this is in the prevention and screening side or in the treatment side. And that is an access to care issue, but it's also a research question. And we can provide the information and the data and the structured intelligence to be able to do this well. I think that's a huge frontier that we are very interested in being involved in. And 100 other things, but
100 other things, but I think the theme that I keep hearing is it's all about the people. It's the people who are affected by cancer, the community that comes together to care for people with cancer. So it's, again, the village. We have our next question here from YouTube. How does NCI continue to work toward health equity, meeting people where they are?
Okay. So I think that it's important to point out that in the National Cancer Plan, one of the 8 goals is to eliminate inequities. I like that you've mentioned a couple of times about the goal as well to engage every person. I think those two are really truly foundational. but transform the National Cancer Plan to be attentive to both the fact that everybody needs to be involved, that's really everybody, but then an intentional look at where there are health inequities and tackling those where they are. So part of it is understanding where there are inequities, and part of it is learning how we can best provide service to people who are otherwise marginalized. So we have lots of programs around the NCI that are diving into these, but the intentionality of the National Cancer Plan really focuses that.
Yeah, absolutely. And like you said, it's not a one-size-fits-all solution. So it's meeting people where they're at, which is what the intention of that question was. The next question is from Facebook. Budget. The question about budget. Budget is such a big part of maintaining the current cancer research enterprise and possible expansion. How can you make an impact as the current budget unfolds?
Well, I would say one of the things that I've learned a lot in the first 2 months is about how the budget works here. It's, as everyone knows, we're still waiting to know our budget for fiscal year 24. I will emphasize, though, that that doesn't mean we're waiting. We're still taking action, still investing, still moving things forward. But having to do that with some sense of prioritization and really being prepared for what the budget is. I will say science, clinical investigation, all of the work that we do is it's valuable, it's manpower intensive, and it's expensive. And it is really necessary that we continue to have the resources to be able to grow. I think that the opportunities are so tremendous that these are investments that will pay out in lives saved, in improved lives overall, in our workforce, having a scientific, skilled talent pool that, for my purposes, is attentive to cancer, but broadly as well. So the funding that comes for cancer really pays off just in huge ways. So we're working hard with the budget that we have, and we're really working hard for those who we can work with to get our budgets to understand where those investments will help us.
Absolutely. I think we have to, right? So that it's definitely not an easy question to answer, but we do what we can with what we have. The next question is from a viewer who wants to know, what are some pointers for emerging leaders in oncology research?
For emerging leaders in oncology research. I think one of the most important things is to find something that you're just passionate about and really lean in and go all in. I would say that when I think about my past, and I shared a little bit of my journey, part of what allowed me to get to this place was at different points in time, just being all in on kidney cancer and really wanting to make a difference for those patients that I was seeing, wanting to make the biology make sense, wanting to connect with the community. And that was a vehicle that led me to get to the next step. So I think the ability to know what really gets you excited and makes you want to move on will help to kind of propel into some of those leadership positions. I think leadership also, you learn to walk the walk, and you learn to elevate people around you. Leadership often really means that we need a whole team. I used to play basketball. I love watching basketball. I love seeing all of the different parts that make a basketball team successful. It's different players, it's different plays, it's different skill sets, it's different coaching, it's different environments, and all of those go together so that a team can get into the zone and work really well. So I think taking whatever gets you to the zone and bringing that to your team, it's the most fun thing you can do.
Yeah, absolutely. Teamwork. a new teammate, if you will, a player that's been introduced to the team is AI. There's been a lot of conversation about the application of AI. So this viewer from YouTube wants to know your thoughts on the application of the latest AI and computational development towards healthcare.
Well, so that gets to another one of the goals of the National Cancer Plan, which is to maximize data utility. There's lots of data out there, and we need to know how to use it well. Everything that we do today is data intensive, and it's more than we can all do on our own. So AI is an incredibly powerful tool to be able to move forward. So the NCI has a number of experts who are really working on where we put our investments in the AI space, as well as making sure that we're partnering well with the community that's bigger than the NCI. I think the opportunities are tremendous. It is important that we convey how respectful, though, that we're being of this new tool, and being sure that we're recognizing patients' autonomy when it comes to their data, and helping people feel confident and secure, and that they can trust when we talk about doing AI, what it is that we are wanting to do that is beneficial for everyone without undue risk. I'll just give you a couple of examples. I am really excited about AI in the digital imaging space, for example. There are sometimes too many variables for a human set of eyes to look at in looking at a piece of histology, for example, or in a radiograph, that a computer can do with a lot more flexibility, and can look at all of the different potential interactions to give us a different interpretation, one that could be faster, one that could be potentially more accurate, that could give us a little bit more intel. So I am really excited about AI. I think that it will change the way we practice medicine, and we're going to learn just a ton from it. And I think we will have to learn what the guardrails are as well.
Absolutely. I totally agree with you. I think AI is here. It's here to stay. I love what you said about being respectful, because that's the best way to be able to use the tool to our advantage. And there are lots of opportunities that we may not still be aware of. So it's to our advantage to be able to sort of use it for what we need to use it for. Yep. Our next question is from LinkedIn. How does NCI ensure their designated cancer centers drive research, treatment, and techniques into communities where the majority of patients live and receive care? In other words, smaller towns across the U.S.
Yeah, so first I'll say that I am very sensitive to this issue for a couple of different reasons. One is I grew up in one of those small towns. I grew up in the middle of Iowa, in a very small town where our healthcare was 4 hours away. So I want to emphasize how important that is to me, that cancer centers are able to reach a broad network. When before I came here, I was at Vanderbilt, which is in Nashville, Tennessee, and Nashville's a thriving metropolitan area, but it's surrounded by a lot of rural Tennessee, Kentucky, Alabama. Our patients came from a long distance and had very different local healthcare experience than what we could provide. And part of the things that we learned in the pandemic, for example, was how to share patients in these spaces and how to provide different kinds of experiences for them so that they're getting the care that they need in the place that is their home. So I think all cancer centers have programs that are designed to outreach into communities. I think it's something that we can do better, but we do with a lot of intention, and is a major focus of all of our boards. It is a major focus of our leadership at the NCI, because as you said, not every patient can come to an NCI designated cancer center all the time. They live much further away, and they still need the care that we are able to deliver.
Absolutely. We have, I think we could go on like this for hours. I feel like there's so many things to ask, but we're almost out of time. But I wanted to get to a question that that you've received before on your Twitter account, where you've talked about mentorship and training, and something that's been very central to your career and something that you're very passionate about. How is NCI committed to career development and support for the next generation of scientists and clinicians?
Yeah, thank you for giving that question, because that is something that is really central to me. So I mentioned that my parents were teachers. I think I grew up with that sense of wanting to develop people, so talent development and helping individuals achieve whatever they're most passionate about or what their potential is. So I have had lots of different experiences with mentorship, both in my own laboratory, but as I moved into leadership positions. And that is how you make an organization or a team really thrive, is by helping individuals find their way and helping them learn what resources they need to be able to be successful, and caring about them, not just in their professional space, but also as a person. So Vanderbilt, I said Vanderbilt, and I mean NCI. So NCI has a lot of programs that are really geared around career development, professional development, and early stage training to get people interested in cancer research, to get them the skills that they need to be able to be successful in that space, and to tap mentors who can also bring them closer. So I'll be bringing things that I learned in my time at Vanderbilt here, but there's already a robust infrastructure. And that is one of the things that I've really enjoyed learning about and really getting to be a part of.
That's awesome. Thank you for answering those questions for us today. Because we only have 30 minutes with you, we couldn't get to all of them, but I wanted to see, did you have any parting thoughts for our viewers today?
Well, I wish we could go on and on as well. So I am really glad to hear from people. That's number one. The things that are on people's minds are also on my top of mind. There are a lot of challenges ahead. We've talked about budget. We've talked about some of the harder things to tackle, like geography and health equity. All of those are problems that we can solve together, and every challenge is an opportunity, and I'm looking forward to tackling them with everyone here.
Yeah, I love that. Every challenge is an opportunity for sure. It's been such a pleasure spending some time with you today. I hope we can do this again soon. And many thanks to everyone who tuned in and for all your questions. And again, if you or someone you know have questions about cancer, please call NCI's Cancer Information Service at 1-800-4CANCER or visit cancer.gov/contact to live chat with our cancer information specialists. And if you missed any parts of today's event, the recording will be available on NCI's Facebook, LinkedIn, and YouTube pages. Thanks, everyone. See you all soon. Bye.
Thank you.